field that's truly committed to fighting for all of us, not just the special interests.
I first heard about Kimberly because of the brand new Congress endorsement.
By not taking corporate PAC or lobby money, she's showing that she will only be accountable to us.
And we can really use a progressive voice from Iowa in the Senate.
She supports things like the Green New Deal and the Clean Air and Water Act and doesn't take any money from lobbyists. Please join me in voting for my future by voting for Kimberly by mail. Thank you.
For United States Senate here in Iowa. We have an extremely special Zoom live stream here tonight. And I'm very excited to have all of you with us and very excited about the guests that we have here. I will just very briefly introduce them and let you know about another guest that's going to join us later here tonight. She had a prior engagement, so she wasn't able to get free till a little bit later. And then I'm going to let our guests introduce themselves a little bit more as well and just explain why they care about Medicare for All and you know what their involvement and what their activism and organizing and writing and speaking and all of that has been. So I want to introduce Michael Lighty first. Michael Lighty has been organizing, speaking, writing policy on Medicare for All for over 25 years. And he is I'm sorry, Michael, is the title fellow at the Sanders Institute? Fellow. He's a fellow at the Sanders Institute. And, you know, of course, has been instrumental. Those of you who already know Michael will know that he's been critically instrumental in all of the Senator Sanders Medicare for All policy writing and all of that. And then Amy Vilela is a former candidate for House of Representatives in Nevada. In 2018, if you ever saw the film with AOC, Amy was one of those people in that film, as well as Paula Jean Swearingen, called Knock Down the House. If you've never seen it, go watch it. And she became an activist for Medicare for All after she lost her daughter, largely in part because of our lack of a universal single-payer healthcare system in this country. And then later on, we're going to have Kathy Glasson with us. Kathy Glasson is a former candidate for governor here in Iowa in 2018. And she is also the president of the Iowa chapter of SEIU, the nurses union, and she's also a registered nurse. So with that, Amy, do you want to go ahead and tell a little bit more about your story and who you are? And I don't know, I feel like maybe because I'm a lawyer, I feel like I have to do a disclaimer. Amy also does our FEC reporting. So that's how I know her as well. She's fantastic. We had a different FEC reporting person, and then we were fortunate to find Amy a few months ago. So Amy's been on our team for a couple of months, helping us keep all of our dollars and cents straight and keeping the FEC happy. So thanks, Amy, and thanks for being here.
Well, it kind of goes into my story. 5 years ago, I was just your typical everyday working person. I had been, raised in poverty. I clawed my way out of it. My father was a union iron worker. My mother a secretary. And I ended up being a teenage, wed mother, young mother. And of course, that marriage unfortunately didn't work. So I ended up being a young teenage single mom. And I was on Medicaid, WIC, and food stamps. And I clawed my way through, and I had believed in what we're always told, right? Kind of the bootstraps story, that if you just work hard enough and pull yourself through, that you're safe and your family will thrive, and that you'll be protected from anything really bad coming to your family. So I worked my way in evenings and went through college, put myself through, first in my family to graduate, and eventually became a CFO and remarried an officer in the Air Force, and things were looking good. I had that executive home. I had that, that lifestyle, and thought, we'd finally made it. I was going to be able to give everything back to my kids that I wasn't able to give to them when they were younger. And, then I understood just what loopholes in our system really, truly means. Here we were, at that point, I was dual insured. I was on Blue Cross Blue Shield and TRICARE, and my family, my kids were young and they were all covered, except Shalyn had her own coverage. And my daughter was 22. She was living in Kansas City, and she was a CNA working her way through nursing school. She decided she wanted to come to Las Vegas, and to be with us. And we were really happy. It was going to be the first time in a long time that my family was all together. And to make a long story short, Shalyn drove out from Kansas City, 22-hour drive. Shalyn was Black. She had sickle cell trait. She was on birth control. And she arrived with a red and swollen leg. And she kept saying, Mom, look at my leg. And I was on the way out the door to go to a business meeting. And again, she just arrived. And as I got to the business meeting, I got a phone call from her. She's crying. She's in the ER. And she's saying, they're telling me it's going to be very expensive. They're asking for insurance. They told me I could leave now. It won't cost anything. It was a very quick phone call. So I told her, you know what, Shalyn, don't worry about it. We've got it covered. Just be seen. I got another phone call. And to be honest, I was kind of getting frustrated. I'm like, why do you keep calling? And like most Americans, we think when you go to get to the hospital, you're going to be seen and treated. And Shalyn proceeded to tell me that she had begged for some diagnostic testing and something for the pain, and they had told her to go get insurance and see a specialist. They weren't a doctor's office, essentially violating what's called EMTALA. It's a law that's supposed to protect us. Little did we know that Shalyn had a blood clot. She had every risk factor and symptom for a blood clot, and they essentially sent her to her death. She had to go back to Kansas City and got on a plane. And it wasn't but a week later that I was holding my daughter in Kansas City, dying an absolutely needless, painful death, and preventable, simply because she could not provide proof of insurance. So there was about a year, Kimberly, where I felt like I didn't want to do anything. I didn't want to even live, to be honest with you. That kind of pain is undescribable. It's unimaginable. And, it finally came to a point. I remember I met actually Senator Nina Turner and heard her speak about Medicare for All. I wanted to know what this was. And at this point, it was from the perspective of a CFO. I couldn't understand insurance outside of employers, right? And I heard her speak. And she says, afterwards, I went up to her and she was like, what are you going to do? Are you going to fight, or are you going to let them make you a victim too, Amy? And I'm like, I'm going to fight back. And when I started to understand how this all worked and how much not only it's humane and that it works economically for the individual, and it would save families tens of thousands of dollars a year, but it was also, from a business perspective, also very economical. And then I was like, I have to fight for this. And I can't sit back. I've seen evil. I've seen what it does, and I cannot turn away from that. And that began my fight, and hence why I haven't rejoined the corporate world. And I have instead become a fighter for not only universal health care and healthcare justice, but understanding that it's intersectional and fighting for, economic, racial, and social justice also. And that's why I'm so excited to support your campaign and excited that you had me here tonight.
Well, thanks. Thank you, Amy. And Michael, tell us a little bit more about you and your over 25 years of fighting for Medicare for All and writing about it and how you got involved with all of that.
Well, thank you, Kimberly, for having me on and being a part of this discussion. I did work for National Nurses United for 25 years. I was the director of public policy there. I've had the honor of working with another of your guests, Kathy Glosson and Amy Vilela, on a number of campaigns. And it is, I think, particularly true now for Medicare for All that the Senate is actually the most important legislative body in the country for this issue, because it's the place where we know good ideas are often stymied by the Grim Reaper on the other side of the aisle. And also what really is the key decision-making body for national policy on healthcare. So I'm really excited to be a part of this discussion, because your campaign couldn't be more important for this issue. And what we've learned in the pandemic is probably what many of us knew already, but has been revealed much more widely, and that is the gaps in the present system are exposed for all to see, and the lethality, frankly, of those gaps is plain to see as well. And so all those things that we say, why do 2/3 of Americans have 2 or more chronic conditions by age of 65? Because they don't get the healthcare they need. What happens when you have a chronic condition in your late 50s and 60s? You get a severe case of COVID-19, and in many cases, you don't survive. And that's a direct result, again, of the gaps and discrimination and lack of guaranteed health care for all of us. And when we look at it, Kimberly, as you know, it's not just the folks who have insurance. Amy's story, of course, is profound in that regard. It's people with insurance who have a high deductible, who get treated differently because of their race, who don't have access to the same treatments and drugs as the wealthy. All those things come into play in a system where you get all the healthcare you can afford, but not necessarily the healthcare you need. And that's why when we talk about Medicare for all, we talk about guaranteed healthcare. And we talk about the difference between insurance coverage and getting care. When you have a $1,500 deductible, that is a barrier to care. When you have a copay, when you go to the doctor, you may not be able to afford it. When you have to get a prescription drug that costs $300 a month, in a case of insulin, for example, even with insurance, you can't afford it. And so what it comes down to really is the greatest concern, as I know of Iowans and Americans, is will I be able to afford the healthcare I need when I need it and go to the doctor of my choice? So that's the strength of Medicare for all. Go to any doctor you want, complete coverage from dental to prescription drugs to inpatient to mental health, real parity in all regards. And I think the other lesson I've learned from being in Iowa is that when you privatize a system like we did through the MCOs in Iowa, you're now reducing even further the amount of dollars that actually go to healthcare. So now the MCOs siphon off another 10%. And you found, again, Medicaid in Iowa got worse. And yet, even in Iowa, we have an example of what does work. Because when Iowa looked at the most chronically ill, they created the wellness program and eliminated all those out-of-pocket costs for the dual eligibles and the severely ill, low-income folks. So those folks in Iowa don't have the financial barriers to care, and that program works better. And the truth is, if we could emulate that model, we could guarantee healthcare for everybody. And that has been the passion of my life. As you say, I've been doing it, and I have the lack of hair or gray hair to prove it since, since
it makes you gray working for all this. It makes you really gray you're working for justice.
Right, exactly,
is that the result? Because I'm going to have to.
Yeah. If you want to stay that color, Amy, you better start coloring your hair now. Yep, it's absolutely true. Well, yeah, I mean, I know for me, I'm now that I'm running for office and I'm working as little as I can get away with, so I have more time to campaign. I've cut back my work schedule, but even so, I'm a, lower middle income person, and I have a $1,500 deductible. And I will tell you, absolutely, with $240,000 in student loan debt that I have after paying for it every month on time for 20 years, and that's a whole other show, as they say. But the kind of student loan debt that I still am saddled with, I don't go to the doctor. I don't go to the doctor unless I absolutely have to. Mm-hmm. And there's things I probably should have checked out. I'm not going. Why? Right. I don't have $1,500 laying around. And I don't want to have that debt that I now have to dig myself out of. So it's absolutely true. I mean, and, if our system was producing decent results, I'd be like, okay, well, great, it's working. But our life expectancy, as I know you both know, just dropped below Canada's in the last year or two for the first time in a very long time. And that should tell us something about how the fact that our healthcare here simply isn't working. So
Kimberly, on that point, it's actually remarkable that life expectancy for the first time in the history of the West, of the Western world, declined in the U.S., right, for 3 years running. And some very prominent economist, a Nobel Prize-winning economist, Angus Deaton, has said that how we finance healthcare is a driver of inequality. Yes. And he's done a lot of work on the deaths of despair, right, and the opioid crisis and so forth. These are completely linked. Deaths of despair, lack of, say, drug treatment, declining economic opportunities, and an inequitable healthcare system that represents crony capitalism, not guaranteed healthcare. And so it's not only doesn't work for us as individuals, it obviously doesn't work for us as a society, but all of what we're learning in the pandemic is it doesn't work for providers either. because all the incentives that hospitals have for private payers, for private health insurance, has now imploded because those services are not being delivered. The private payers are not there because the patients aren't there. And all of a sudden, that dependency on the private insurance companies has come home to roost. And we as the public are going to end up paying to keep those hospitals open.
Yeah. I mean,
it's interesting.
Absolutely. Go ahead, Amy.
I have a dual perspective on this. Being a military spouse and having access to medicine that's free at the point of service. I was just telling Michael earlier that I actually had a scare this last week, 2 days ago, and I had to go to an ER. I went to a military hospital, no waiting lines. Again, everybody in the military has free health care at the point of service. And I sat there. I had actually a scare with a blood clot in my leg. I have factor V, and I had been sitting making masks for frontline workers. Went in immediately, had 3 doctors standing there. My legs were measured. I had bedside ultrasound, blood test. And I sat there thinking with tears streaming down my face, the difference, the inequality in treatment, and the difference for people who don't have health care and have those barriers. And never once was it asked, do you have health insurance? And should we run this test? Is it covered by your provider? And on the way out, I got my medications for free, and they even gave me aspirin for free. I mean, that's the difference between a system where there is no barriers to care, and the concentration is the care of the patient versus what is your insurance status. Now, I've also been, before the military, before I married my husband, in the private sector as well, in the hospitals, and it's vastly different.
The first thing they want to know is, how are you going to pay for this? What's your insurance? Yeah. You can't even get past the gate at the emergency room without giving them an insurance card.
Well, even the tests dictate. I mean, your insurance company and whoever's sitting behind there administratively, they're dictating what test you can and cannot give depending on what your insurance is. So even if you have insurance, you're not 100% safe because you're not guaranteed you're going to get the test that the doctor has decided that's necessary to treat you. And B, just because you have insurance now, is everyone's learning right now through COVID, you're not guaranteed it throughout when you might need it if you lose your job, right? And we are at around 70,000 deaths right now. And let's put this into perspective. So over 60,000 people a year are dying from a lack of health care, in addition to what we're seeing right now from COVID. Right. And so this is an emergency for our country. This is not a political idealism. We're actually in an emergency year round, year after year. And COVID's really bringing this to light to many more Americans that might not have experienced that. It's bearing to light even more now how important it is to have people like yourself fighting for this in the House, in the Senate, and making sure that we have true healthcare justice for everyone.
Yep, absolutely. One of the things that I started getting a little testy in our little candidate forums, because the other candidates running for this seat have realized that the fact that I was the first one saying healthcare is a human right, and they thought it used to get like applause and stuff at our forums where we would all appear. So now these other candidates are saying healthcare is a human right too. And every single time we have another candidate forum and one of them says that, I just sit here on my Zoom, and my head almost explodes. And then fortunately, sometimes I get a chance to say something after that. And this is what I say. First, we have to decide if healthcare is a fundamental human right or not. Yes or no. There's no other answer. If it is no, carry on. Good for you. If it's yes, then it never depends on how much money you have. Last I checked, human rights were not commodities to be bought, sold, and marketed. You don't get more human rights if you have more money, and fewer human rights if you have less money. And then I see the other candidates kind of looking at their papers, because all the other candidates in this race are for some kind of a public option-y kind of a thing, right? So, their idea of human rights is very different than my idea of human rights, I guess. So in a moral and wealthy nation, I think AOC started saying that, at least that's who I first heard it from. In a moral and wealthy nation, healthcare should be a human right. Human rights are not for sale. then here we are. So Kathy joined us. I just want to say hi and have you introduce yourself a little bit, Kathy. I spoke about you earlier, said you'd be joining us later. But Kathy Glasson is a former candidate for governor and president of the Iowa SEI, I always get the letters wrong, SEIU union, and a registered nurse as well. So welcome, Kathy.
Great. Thank you so much for letting me join tonight. I really appreciate it. Hi, Michael.
Hey, Kathy.
I know, Michael. Good to see you. And Amy, I saw you speak about Medicare for All back, I think it was in Cedar Rapids. We were trying to educate union members on what Medicare for All meant for union workers as well as just the general population. But I'm Kathy Glasson. For those that have not seen me speak or talk, don't know who I am. I am a registered nurse, worked at University of Iowa hospitals and clinics for over 18 years in the medical intensive care unit, which is the ground zero for COVID-19 ICU patients here in Iowa City. I actually helped form the union at my hospital with my fellow nurses and healthcare professionals that wanted to have a voice on the job. And my union life taught me that activism is extremely important if you want to see anything change in your community, in your state, or in your nation. And that's how I got politically involved and active in politics, mostly behind the scenes of, talking with candidates and encouraging them to support policies that will support working families in our state and in our country. And then we had some changes in our state legislature in 2016 that were detrimental to workers' rights and worker safety and health care for Iowans. They privatized Medicaid in the state of Iowa, and that left hundreds of thousands of Iowans without the health care that they need or the supplies and services they need, and then they didn't pay the physicians and the providers. It's been a disaster and continues to not work for most Iowans that need the care. So I made the decision because of some attacks on workers' rights and unions in the state in 2018 to run for governor of the state of Iowa as a registered nurse. And my some of the core issues that I ran on were union rights, worker safety, worker rights, and Medicare for all, and that Iowa should lead the nation because we're a small enough state to actually test this out and show that we can actually cover everyone, save money, and make sure Iowans get the care they need when they need it, and they don't have to worry about how they're going to pay for it. And my like you, Kim, I totally believe it's a fundamental human right, and people clapped when I said it. The really cool thing is, Governor, my opponents that ran, that I was running in the primary with, didn't say that. They couldn't say it was a fundamental human right because they knew they couldn't get away with it, not with a nurse running for office. And so what you're doing is so important and is such a popular thing that people are craving a healthcare system, not an illness system, which is what we have now. We only want to take care of people when they're sick instead of making sure that they remain as healthy throughout their entire lifespan as they possibly can from birth to death. And so I'm really honored to be here with you. As I like to say, everybody in, nobody left out, and we can lead the way with Kim running as the senator for Iowa, and you do a hell of a lot better job than the senator that we have currently. So I'm really excited to be here. Thanks for inviting me.
Thanks. Thank you. So I'm going to pop in really quick to this chat and see if we have questions here. Somebody said they love me. I love you too, Arya. Yes, we need Medicare for all. Feel free to. Okay, there's just like nice things being said there, but no questions that I see so far. If there's any more, yeah, toss the questions. You guys
Kimberly,
have questions going on. Toss them in the chat. Okay. Yes, go ahead, Michael.
Well, I was going to say, I know that many Iowans are concerned about the impact of Medicare for All on insurance industry workers. And because I know that Iowa is a big insurance state. And so I think it's important to understand that the legislation in the Senate initiated by Senator Sanders and co-sponsored by 15 other senators, does provide for a just transition for those workers. I had participated in a study done by UMass Amherst researchers that identified who are workers in administration on the insurance industry side and also on the hospital and provider side. And we identified the demographic and earning profile of those workers and found that we can create over a 5-year period a program that maintains income, provides for job placement and job training, bridge to pension for older workers, and really does provide the kind of what we call just transition, a transition that takes into account the economic security of those workers. And a robust pandemic support program would be like this program. If we had a real support program that kept people's wages coming and their health benefits in place, that's the model for what we're talking about here. We know, for example, that over the next 10 years, there'll be 3.5 million new jobs in healthcare. Many of the folks who work in hospitals and administration might very well go into those clinical jobs. Many of at least some of the jobs that currently are done by insurance industry folks would continue to be done as claims processing. They wouldn't be underwriting, they wouldn't be denying care, but they would be processing claims. In fact, some insurance workers already do that for Medicare. So I think there is that notion that, hey, a lot of the industry workers would rather be helping people get healthcare than denying them healthcare. And we can provide for a transition for those workers and we're convinced maintain, according to these economists, the health of the workforce and of the state.
That's a really important point. A point that I've talked about that as well when I'm, out talking to voters and campaigning. Well, when I was out, now I'm on Zoom talking to voters and campaigning. But one thing that I've talked about, and I used to get a whole lot of heads nodding when I would say this, is even for people that are working in the health insurance industry, and here in Des Moines, where I am right now, it's one of our very top, if not the very top industry. I should double check that statistic, Tim, if you could look that up for me. But I want to say it's well into the tens of thousands, 70, 80,000 plus jobs are insurance industry jobs in Des Moines. It's a huge, huge, huge industry. And one thing that I have mentioned, though, is what about the trauma and the trauma and the emotional price for people sitting a few miles from here at Blue Cross Blue Shield in their cubicle, listening to people call and scream at them and cry and yell at them because they're having to tell them that, no, your insurance isn't going to cover that, or no, we're denying that claim, or no, we're not going to cover that particular drug. I mean, I don't think that's insignificant. I don't believe that the people that work in kind of the lower paid processing type jobs in that industry certainly isn't their fault what's going on. And they're the ones that have to actually be the front line telling these people that are distraught trying to get care for their loved ones that no, Blue Cross Blue Shield isn't going to pay for that. I had a really strong supporter of our campaign works as an emergency room admitting clerk. And she deals with that all the time, where she's having to deal with people's insurance and find out if they have insurance before they even can get seen. And they're in the emergency room, and she's like traumatized by it herself, that she's having to tell these people, oh, your insurance expired, or, oh, that'll be a $500 copay. Do you have that now? That kind of thing. And there's a lot of that. There's a cost there, a human cost as well, to the workers who work there. And when you mentioned about businesses, it just kind of made me think about the fact that my understanding is we're losing quite a lot of businesses that could be employing Americans to Canada because they just look over the border and say, oh, what's over there? Oh, a place where I don't have to deal with paying part of my employees' insurance premiums every year, and I don't have to deal with looking at a new plan every year and informing my employees the deductible's going up again, and so is their premiums. And they just pick up and move across the border to Canada, and we're losing business that way. Can you imagine how many people who might be doing a job at an insurance company who would like to start their business of their own, and they won't because they have a family? They're not going to leave Principal Group or Blue Cross Blue Shield and go start out on their own. Because why? Because they don't have $2,000 or $3,000 a month to pay an insurance premium because they want to go start a business. I mean, it would be an explosion of entrepreneurship if we had universal single payer in this country.
Yes.
Yep.
Well, and that's something that really goes across even political party lines. It goes across all of this, right? First of all, when we talk about, the effect on everyday people, this is not a party talking point. This is a we the people talking point. And when we talk about businesses, I was one of those people. I was a CFO sitting there spending weeks looking at plans. And let me tell you, how we decide is we have a spreadsheet. I know nothing about healthcare and how to give it, but I'm trying to decide which one's the best, which one looks like it gives more, and we don't have that much of an increase that we have to increase our employees, portion that they are providing, and what can we afford. Now, for a small company of around 20 to 30 employees, we're talking about a cost of roughly about $400,000 a year. And so when we talk about small businesses, and I know Iowans, there is a lot of small businesses in Iowa. When we're talking about being able to compete and being competitive, now you've lost the ability to compete against large companies. You can no longer go to a company because you like their company culture or really like the people working there. Now you're having to go to a company who provides the best health insurance. It really is an equalizer also for companies. I mean, leaving out the whole that this is a human right and the humanistic part of it, if we were just to talk about even the economic portion of it, I always joke around and say, businesses, if they understood how much they would actually save and where they could actually invest that money back into more employees or research and development, they'd be on the picket lines with me. So there is really, when we're talking about businesses and in the economy and economics, the more money that they have and the more money that people have, everyday working class Americans have in their pocket, the more money they have to put back into the economy. And that's really, when we talk of economics of Medicare for All, that is a huge economic boost to any economy, any small business owner, and any working class American. And working class Americans don't put money and put it aside in a savings account or put it overseas. They put it back into the economy of their community, purchasing goods and getting out there and supporting local businesses. So it's a huge economic boost. And that's in addition to the whole, when we talk about human life, I mean, I always tell people, to treat Shalyn would have been a couple $1,000s. It cost all of us taxpayers, you included, and every Iowan that pays into taxes, $300,000 because the U.S. government had picked up that tab. And so when we think about that, that's one of the 60,000 that die a year from a lack of health insurance. When we talk about the economy as a whole and economic, output, it's really a no-brainer for Medicare for All.
Yep, absolutely. We have a couple questions, so I'll let all of you experts tackle some of these. Terry asks, what are the root causes? Oh, me, I can answer this. What are the root causes for why we don't already have universal health care? And which of those root causes should be attacked first? Our campaign slogan is best senator money can't buy. That's a hint for why we don't have a universal healthcare system. Okay, but I'll let you all talk about the more deep answers. So what are the root causes? Why don't we have this? My understanding is we almost did have it back in Nixon's era, and it didn't happen.
Well, we've been close a few times. The pivot point really started during World War II when wages were frozen and employers were looking to satisfy disgruntled workers and offered private health insurance as a benefit. And then the government said, hey, that's a great idea, so we'll make it tax-free. So you don't pay payroll tax on insurance benefits, but you do pay it on wages. And so it's quite a boon. And that has ballooned to a huge budget item, actually, nearly $300 billion a year. In subsidies for private insurance. So that really ingrained the private employer-based insurance system, which of course is again imploded during the pandemic. But the other point that you make, Kimberly, is exactly right, is that the insurance companies really, and the whole industry as a whole, grew up since 1980 based on profit and making money the metric of good medicine. And Angus Deaton, who I referenced earlier, has described it as the worst example of crony capitalism, the way we finance healthcare. And it's precisely what you identified. They have 3 lobbyists for every member of Congress. They are the most effective lobbyist group in the country. They are always feeding at the public trough, and it has distorted healthcare and skewed us to the point where nearly 100 million of us don't have adequate coverage. And that is precisely the problem. That's the root cause as it is now. This guy is a mainstream economist. He's not a lefty. He says, look, I don't generally favor, government financing, but in this case, it's the only solution. We have to go to single payer financing. And it also addresses the question around who's going to control healthcare decisions. And I'll let Kathy take it as a registered nurse. But the difference is this is a doctor-nurse run system, not a bureaucrat-run system.
Mm-hmm. I actually call it crony. I call it crony socialism instead of crony capitalism, because the socialism piece of it is that our public money is going toward creating more profits for private corporations. So it's pretty ironic. It's pretty rich that the insult the GOP likes to hurl at people is socialist, when actually the wealthiest people in our country still don't fit the actual definition of socialism, which is government runs the means of production. But if we're going to toss that term around, we subsidize the very wealthy more than anyone else through incentives and subsidies and tax breaks that they don't need, never needed, and so on. Anyway, go ahead, Kathy.
No, that's exactly right. And you can talk to Wendell Potter, who's one of my favorite people. I don't know if people have heard of him, but he used to work for Cigna Healthcare. He's an insurance guy, private insurance executive. And he has seen the light, and he knows that the whole issue that you were talking about, Michael, is what this is really all about, is making money for shareholders of private companies and corporations, making money off the backs of people, and they make money by denying care to individuals. And so until and unless we change that system, we are never going to change the healthcare direction in this country. Now, I think it's inevitable that we will get to single payer, because the current system is unsustainable. It is too excessive and totally outpriced for the average person. I'm a union member, and negotiating insurance benefits is one of the highest cost items when we're going to bargain with employers. Going to a Medicare for All single payer system takes that money off the table and puts it into healthcare for workers and people, versus having all the overhead and negotiating. The employer has to have an office for healthcare claims and insurance processing. So the amount of money going into the system that isn't used for direct patient care by the doctors and nurses that know what needs to get done is just incredible. And we do need to give the power back to those that know what's best for the patients that we care for every single day. We need to be driving the healthcare system, not corporate executives and CEOs of insurance companies. And I know this personally. My husband's diabetic, and he gets refused. He only gets allotted amounts of insulin syringes. He only gets allotted amounts of testing materials. And if he runs out, he has a continuous glucose monitor that he wears. And if for some reason he can't, he uses one and it fails, he's short one for the month. And so he can't ask, the insurance companies will not give him any extras. And he goes without for an entire week, and maybe sometimes 2 weeks, until he can actually get the shipment released from the insurance company to let him have the things that he needs. In the richest country on the planet of this earth, it is incredibly sad to know that we can't provide essential basic health care to our people. And if you can't tell, I'm angry. I'm very angry. And I know you two are, Kimberly, and I'm really excited that you're marching for Medicare for All, because that is the only way we're going to get to a solution. And I just want to add one more thing. I was on a Zoom meeting shortly before this, and that's why I got on a little bit late. and there was a small business owner, just like you were talking, Amy, about your experience as a business, somebody that runs a business or makes decisions. He just said that the family plans for businesses over the last 5 years, just for a small business owner, went up 22%. And over the last 10 years, their costs for healthcare for their employees went up 54% over the last 10 years. So it is unsustainable for us to continue this model. And that's why it's so important to talk to voters like you're doing, Kimberly, about how important this is. So kudos to you, and it's so needed.
Well, I want to talk a little bit more for a few more minutes, and then I think we have a few questions I want to make sure we get to, but about unions. So, a lot of this is it's all interlocking puzzle pieces, really. But for those of you who don't know, I was a volunteer union organizer with my union, the American Airlines Flight Attendant Union, the APFA, for 13 years while I went through undergrad and law school. And my dad is a lifelong union worker. My mom is a lifelong union worker. My son's father is an IBEW electrician. My grandfather was in the Carpenters Union all his life. My stepdad is a firefighter, well, he's now retired, in Firefighters Union. And my son has his welding certification and just started as a helper with the IBEW as well. So to say that I have a lengthy ancestry of union workers, including myself and my family, is an understatement. And so all that to just say, I understand the importance of unions like I don't think anybody else could, because that's why I was able to live in an okay house growing up. And that's why I got to go to good public schools. And ultimately that may be why I'm sitting here, because I got to buy as many Scholastic books from that Scholastic book order as I wanted when that thing came out, and sat in my room and read all the time, and if my parents were in poverty, I don't think they would have just said, get all the books you want, right? I mean, literally, I was able to do that. So what I hear over and over, and I know, Kathy, you're aware that a different candidate was endorsed by the AFL-CIO recently and by a number of other unions in Iowa. Spoiler alert, not me. That it is just frustrating, because I know my sort of union cred, if you will, and I know that I have actually been a union member. I've walked a picket line. I've been an organizer. I understand unions. And yet a different candidate got all these endorsements. And I'm not sure precisely why that is. I have suspicions. But I've heard over and over, you can't be for Medicare for all because unions don't like that, because they work so hard to get the union health benefits they have, and they want to keep them. To that, I always say, do you have kids, grandkids? Do you know anyone who is not a union worker? What about them? And to Kathy's point, if you no longer have to bargain about health insurance, then go bargain for higher wages, and you'll have more money in your pocket on top of everything else. But there's just this little bit of this narrative in some union circles that I've heard from union workers, that they're hearing from their leadership, I guess, that for some reason we don't want Medicare for all. So it's very odd.
I don't hear it. I don't know, Kathy. I don't hear it from workers. I hear it from officials. I hear it from people who may have a stake in the present system, but I tend not to hear it from workers. And I never, ever hear it from someone who's actually bargained union health benefits. Amy knows in Nevada, we had a little dust up during the primary on this question. And it was precisely the concern of workers when they were just talked about the issue on the doors. What about my relatives? What about my extended family? What about my kids? Exactly. And now, sadly, all those casino workers are out of work, and their health care is obviously in jeopardy. So I think it's an odd argument to say, hey, we've given up everything for health benefits. Please let us keep doing that. I don't think it's a good argument. I think it's illogical, and the truth is that it's expensive, it's unsustainable, and these health plans are in real trouble, and they are not going to survive in the present system. I would say to my union brothers and sisters, given the economics of this country, there are a lot of other good reasons why people are going to join unions. And we don't need to recruit them on the basis of health benefits that are eroding. When was the last time, Kathy, we said, hey, workers, we got a better deal on healthcare? All we got is bad news. All we got is bad news. Why do you want to keep delivering bad news? How about this? We just saved your boss 10% of payroll by going to Medicare for all. And under the legislation, every penny of that goes in your pocket. And you just got a 10% raise, which is actually the way it would go down under Medicare for all.
That's what I was wondering, and I didn't know that detail, so I'm glad you mentioned that, is that if that is the case, where they now are sort of taking part of the worker's hourly wage to pay for health care, they would then see that back if there was a Medicare for all system. That's good to know.
I know in Nevada, like a big talking point with unions, and when speaking with people in Nevada, when I share my story, I say, look, I mean, I'm dual insured. My husband's military, 16 years. We're the people it shouldn't happen to, right? But at Shalene's death, she gave me a gift on the way out. And that was reminding us that we're only as safe as the most vulnerable in our community. And that having insurance yourself is not a guarantee that your best friend, your relative, your child, and everyone else that you care about in your life has adequate health care. And if they have some form of health care, is it adequate enough where they don't have barriers to care to go get the care that they need and that's necessary, right? So just having insurance doesn't necessarily mean even that you have enough insurance to be able to get the care that's necessary for you to survive or someone you love to survive. This really is about community. It's about loving your neighbor, loving yourself, and loving your family enough to know that all of us need to be covered, for all of us to be safe, and all of us to have an opportunity for health and life. That's really what it's about. I didn't think it would ever happen to me. Everyone else's family, not mine. And so when I hear people say, well, I've got my insurance and I love it, I'm happy they have insurance, and I want everyone to have that. Because I understand that a crack in the system now, the way that it is, does and could mean death for someone that you care about. And as long as you're okay with those odds, as we'd say in Nevada, those are the odds you have, then, maybe you're okay with that. But for me, every life is precious, and one needless death is one too many. And people need to start thinking about it in those terms, because that's what we're talking about. If everyone, your grandchildren, your children, everybody's going to work for the union you're with, and that's great. But if they're not, what is their coverage going to look like? And will they even have coverage?
Well, and as we're seeing right now, even if you have a good union job, your good union job might be gone during a pandemic, or it might be gone for whatever, many other reasons. You may not always have that great union job that you've worked so hard to get into, to keep.
Right.
And then as long as your health insurance is tied to that, all they're going to do is say when you're out of a job, well, you can pay COBRA for a few $1,000s a month when you are no longer employed, and try to pay for that on the on the way out. I just so nobody wonders what the heck, like, this guy he's in my lap. So I just want, why does she keep fiddling with something down here? It's because Mr. Lovebug is on my lap and he won't leave. Anyway, Nicholas has a question. Let me check what's happening here in the chat real quick. And then Nicholas has a question. The chat and the Q&A. Yep. We're getting to them as much as we can. Okay, we better start blasting through these questions, everybody. We could talk about this other stuff all day, which we'll get to probably at all if we go through the questions. Nicholas, hey, Nicholas. Nicholas is a lawyer. He and I've been emailing a little bit. He, I think, works in the county attorney's office in Johnson County, if I'm not mistaken. But anyway, hey, Nicholas. Nicholas asks, he says, clearly private insurance has huge problems. If we got to a Medicare for all system, how do we make sure that health insurance company bureaucrats aren't replaced by government bureaucrats making healthcare decisions and put healthcare in the hands of doctors and patients? How do we make sure we put healthcare in the hands of doctors and patients while keeping the overall cost to the taxpayers reasonable? And when I answered that question through email, I said, you have a lot of oversight, and you have oversight that isn't only government officials, but that includes, community members and things like that is one potential way of, making sure that doesn't happen. But I don't know the minutia like you guys all do about how that would all work. Go ahead.
Well, I think that we have to, people that run the system have to have healthcare experience. And that's why it's so important to have physicians, nurses, healthcare folks that know the system and how it functions and what's best for the patients involved in it. So I think your idea, Kimberly, about more community, more transparency, I think is really important. And then I think if you look at, you want to report on outcomes, right? Showing that what you're investing in really works, I think is key to making sure that the system actually works and it doesn't just, because we already know that there are bureaucrats all over the place, right? And the system is failing. And so, and part of that reason is because it's folks that want to make money and that's their main goal. And they want to support elected officials that are going to support their agenda. You know it. We all know it. And so I think, we need to elect folks like Kimberly that understand what's most important, and that's the healthcare of our people, and making sure that that is front and center in any decisions that get made, and that decision makers have that same philosophy. And I'm a big believer in co-governing, where you actually have citizens involved in your policies and decision making, and would be involved in exactly sort of what you said as a community-based input on how things get done. So I just think we'd be a much better country if we did more of that, where citizens had more input than they do now, and have more involvement in decisions they get made around their.
Yeah, absolutely.
So I would just add, Kimberly, on the structural level, there's just a whole different incentives and a whole different structure when you change the financing to single payer, so that we are able to save money by eliminating the overhead and profits, marketing and waste and duplication and all the complexity of the present system, the fragmentation. That's estimated to be at least $450 billion a year. So we have to understand Medicare for All is, as Amy is saying, it's a movement to save lives, but it is also a cost-cutting, efficient healthcare system. So once you eliminate and save that much money, you don't have to deny people care. You don't have to have a bureaucrat looking over a doctor's shoulder, because the doctor and nurse is in charge of the care, because it's based on what you need, not what you can afford. And when we have an example of this right now, Medicare pretty much lets doctors do what they believe is medically appropriate. The provision in the legislation says medically necessary care is covered. That, as I said earlier, dental and mental health. Right now, those aren't profitable. They're not covered. And what happens instead, of course, is the bureaucrat is making judgments, as Kathy says, to make money. So once you do that, you can enable clinicians to exercise their professional clinical judgment, because that's what the system is. And in Medicare, doctors don't have the hassles they have under private insurance. Every doctor I've talked to says they prefer Medicare. Just it's an easier way to deal. We are able to standardize rates, and we're able to give hospitals what's called a global budget. So they have the resources they need to provide the patient care in their service area. No bells and whistles, no concierge, no private rooms, but the basics of patient care are fully covered. So the hospital doesn't have to market for elective surgeries or try to get huge payments on addition. In fact, the payments they get from the government are sufficient to provide for their operations. That's just a whole different way of doing it. And once you do that, the clinicians are in charge. And as Kathy said, once you have everybody in one system, you can actually track outcomes and quality. Right now, these systems don't even talk to each other, right? You go to one hospital and they don't even know what you have had done in another. Once we're in one system, we'll identify the outliers. We'll identify the people who are trying to defraud it, and we'll be very much more efficient.
Yeah, that
also
what you were saying,
the business aspect of it. Oh, sorry.
No, go ahead, Amy.
Oh, sorry. I'll take it another 1,000 feet up. Let's talk about the ability to bargain and to negotiate. Right now, we have a system that's based on a for-profit model, which has tons of salespeople, tons of people bargaining, trying to get sales deals. Each place has a different place. One hospital could cost $1,000 more than another. When we have a universal system, we have a system that has bargaining power, that's able to negotiate rates, that's able to work with providers, streamline it. It's not only are the sellers of the personal equipment or the medicine or whatever it may be, they're able to streamline their services also and cut out a lot of middlemen. So can we on the government side as being able to negotiate rates. We see this working already really well with systems we have in place. When I speak, I always talk about TRICARE, which I'm on, which is a good example that, for about a year and a half, I couldn't use Walgreens because Walgreens wouldn't negotiate with TRICARE. So they said, okay, sift it out. Well, it wasn't even a year actually. And all of a sudden we could go back to Walgreens. They decided they were going to negotiate with TRICARE because it's just economy of scale. So just getting a little deeper for the person that was asking that question, when we're talking about how do we keep prices in place, how do we keep this is a checks and balance system, right? And it has far more bargaining power, but also the ability to keep the system going and keeping supply and demand going.
Something Michael was saying made me think about this, and Kathy, so you may uniquely know perhaps maybe more about this, although any of you may, but I want to talk just for a few minutes about rural hospitals in particular, vis-a-vis reimbursement rates. Now, I might be operating under misinformation here, but my understanding is, number one, about 18% of Iowa's rural hospitals are in danger of closing soon if something doesn't happen, something doesn't change. And number two, that the reimbursement rates that Iowa rural hospitals get from Medicare is entirely insufficient. And number three, I know this for a fact, that we have a disproportionately large number of elders in our rural communities in Iowa. So that means the majority of people using a rural hospital are elders, are people over 65, maybe not majority, but a huge portion of them. So all that said, my concern, and has always been my concern when I've spoken about Medicare for All and when people have asked me about it, is I always say this: look, I haven't read the bill. I've since looked through it, and I didn't see any specific language that says, here is what the reimbursement rates will be. We are going to make sure they are sufficient. And so that's what sort of scares me personally. That's the only thing that bothers me about Medicare for All, is that I feel like, and I don't know enough yet. I don't know enough to know that there's a hard-clad guarantee in there that our reimbursement rates are going to be high enough for the whole thing to be sustainable, especially for rural hospitals. So can Kathy or Michael or any of you address that?
Well, I'll take a shot. The truth is, the guarantee in the bill is that those hospitals will stay open. And it won't just be dependent on reimbursement. As I said, they'll get a global budget to provide for their patient care needs. So, for example, they won't have to rely upon getting in private payers or increased Medicare or Medicaid reimbursements. Medicare and Medicaid are folded into this system for acute care. They are then, let's say that a rural hospital spends $100 million this year on care. Next year, they will get that $100 million and they will get an inflation adjustment increase. We know how much they spend on healthcare, what their actual costs are, because they file reports with Medicare called cost reports. What we guarantee is that those hospitals will stay open and have the resources they need to operate, not that a system is going to be tweaked or a reimbursement program, managed. It's about providing patient care. So it starts from a different assumption, I think, is the number one issue. I always find the argument ironic, because under the present system, rural hospitals are closing all the time. And then we get accused under Medicare for All, you're going to close rural hospitals. The truth is, we're going to keep them open. It's in the interest, once everybody's in one publicly financed system, it's in the system's interest to provide them care so they aren't air-vacked to Des Moines. right? So that they get the care in their communities and that they get treatment, as Kathy said, health promotion, so that we intervene early and don't have expensive cases on the back end.
Awesome. Kathy, do you want to, just because I'm sure that you talked about this ad nauseum when you ran for governor, do you want to talk about this for a minute?
Well, Michael knows the legislation much better than I do because he's read the bill in detail. So he's the expert here.
Bill. No, wait, that was somebody else. Didn't you write the damn bill?
I helped.
So,
I kind of look like the guy who wrote it, but
honestly, the current way we reimburse is insane, right? And it's because it's based on multiple factors and variables, how they decide reimbursement rates now. So we know, I think Louisiana, Michael, you may know this, some of the states get way more reimbursement for their care than Iowa does. We're one of the lower states, yes, I believe, in the scheme of Medicare, how we reimburse for the care through the current system. And so, what we're talking about is really smart, because hospitals, if people are healthier longer, because they can, and you're seeing this in the pandemic. Can I just say this? The disproportionate amount of people, because they don't have access to healthcare, is showing up in this pandemic more than we've ever seen it before in our country. We've always known that folks that live in poverty have a much higher risk of health issues, right? Now it's come to light, and it's on the national, it's in the media, mainstream media. So we're seeing the effects of a system that's failing, particularly people of color, rural communities that we know, Kimberly, we know Iowa rural health is terrible, because most of the folks that live in our state in those rural communities live in poverty, because the economy is not there. So this is crucial for rural Iowa, and it is a way to say, when you're talking to voters, to explain this is the way to keep your rural community and your rural hospital going, because otherwise they will shut down because it's unsustainable. The current model is unsustainable. And so, it's in my mind, it just drives me crazy that we're stuck in this model. And how long have we been talking about reforming healthcare in this country? Can I just ask that? I mean, let's do it, for gosh sakes. Let's get this done and save people's lives, cut costs, and put money in pockets of people so that they can do other things with the cost that they'd normally be spending on their premiums. So, if it's a great argument to have now as we start, parts of our country are reopening the economy, is this is something that we should be talking about as a fix to the issue that we're facing now. And my hope is that out of this pandemic, we will see more discussion on Medicare for all, because it would have been different if we would have had more people covered than we do now. Along with workplace issues and safety issues, Kimberly, like you said, the union difference in this argument is huge. And employers have a responsibility, and we need stricter laws to protect them. And that's where I think you're going to come in the Senate really, really strongly to say we don't have enough worker protections and laws. And also we don't have the healthcare benefits that are needed. Together, those two would be extremely powerful in a pandemic in preparation for future events that may happen to our country. So the fight needs to continue, because I think I know we can get there. We just have to have the will to do, organization to do it.
Yeah, absolutely. Kirk on the chat says, I'm hearing impaired. I can function and work to pay taxes to contribute to our great nation, but no program exists for me to help pay for hearing aids. They cost me out of pocket $10,000 maybe he means every 2 to 6 years or every 6 years. My question is, how does this fix this? I do not believe that is fair to me. Kirk, my understanding is that Medicare for All, the bill that is, as written, covers hearing aids, covers any kind of any kind of hearing aids, covers dental too, which dental is something that we don't really talk about a whole lot. I don't hear politicians talking about it very much, but the way that we don't do dental in this country is a lot of people who you all understand, but a lot of people don't understand how critically important your dental health is to your whole body health. And that can create heart disease, it can create stroke risk, it can create, all kinds of things when your teeth aren't well taken care of. And if you don't happen to have good dental insurance through your work or something, and sometimes even if you do, the cost of dental care is just, absolutely in the stratosphere for people. My brother is a person with disabilities, and he is on SSDI, and he was finally able to have significant dental work done when he was able to go on, when he got his SSDI and was able to go on, I can't remember if it's Medicaid or Medicare. Anyway, whatever he was able to get on as far as a plan covered dental, and he was finally able to get that done. I think it's Medicare. So yeah, it's ridiculous. So yeah, Kirk, that should cover that. Somebody asked an interesting question, and I've been asked this before, and I'm not certain of my answer. And now that I have the experts here in front of me, I'm going to ask. Somebody asked, how would a universal single payer affect the VA? What's the interface, or how would the VA, what's the vision for how the VA, if it still exists, if it doesn't, how would that work?
The VA still exists. It is still separate. Yeah, it's not integrated, but it's better funded.
Well, there's nothing not to like there. Carry on. Next question. Okay, good.
That's good. Kimberly, can I address the question too about nursing home care versus in-home care? It's a bias in Medicare for All for non-institutional care. That under the Senate bill, states would still pay for nursing homes, but Medicare would pay for expanded 24-hour home care and support services for people with disabilities, and including even transportation and meals, depending on income. So it's a very home-based bias in the new system, but still, if folks needed to have that institutional care, it would be fully paid for. And like dental, and like mental health, and like prescription drugs, like hearing aids, like going to the doctor, no copays, no out-of-pocket expenses for the patient. So we're talking about a system fully paid through very progressive taxes that has no out-of-pocket expenses for us. So folks who are now having to pay for the hearing aid or pay for a portion of their nursing home care would no longer have to do so.
Cool. Well, that's what we're doing now. Somebody asked, how can you sell me on a single payer system? Well, I don't know. If everything we're saying isn't selling you, I don't know. Let's see.
We should mention, Kimberly.
I was just saying, somebody said, go ahead. I'm sorry.
I wanted to address, we do cover every resident of the United States, regardless of immigration status. And it goes to the point that Amy was making, is that, as Dr. King said, we are tied in a single garment of destiny. And what affects one of us indirectly affects all of us indirectly. What affects one of us directly affects all of us indirectly. And that's really what we're talking about here. And it's been so profound in the pandemic, is a sense of social solidarity, taking care of one another. If I'm taken care of, I don't have the resentment that someone's getting a better health plan deal than I am. And that's really what this is about. And the pandemic has brought that to the fore. As we've learned, viruses know no borders. And so we literally have to cover everybody.
Yep. Rebecca writes, in my work as an insurance specialist for a small town Iowa mental health clinic, we are reimbursed by Medicare at a rate higher than any other for-profit private insurance company reimburses us. So Medicare at this particular place actually is reimbursing them better at that mental health clinic, which is good to know. Thanks, Rebecca, for mentioning that.
You know, Kimberly, it's interesting, as Michael Lighty and I went across to rural areas throughout the United States, and from state to state, there are many people that worked within the rural hospitals that were saying, if everybody had Medicare, we'd be doing fine. It'd be a gift. We'd be able to keep our doors open. We'd be able to work. We would love that. So yes, this is actually would not only help on a national scale, but specifically for rural communities, being able to keep their hospitals functional and able to cover expenses. And there is also a portion in the bill that actually helps incentivize keeping rural hospitals open. So this is like across the board, very economically positive for hospitals and workers to ensure that they're able to be a going concern.
Yeah. Oh, when you were talking about nursing home care and the bias for, for caring for people in their homes for as long as possible, or, or until they pass away, if that's able to happen, that reminded me of something that unfortunately a lot of people don't know about, but that as an attorney that I have seen, and that is that elders or people where one of the people in the couple has become disabled to the point that they need nursing home care, but they have some kind of a retirement account or a 401k or something they've worked hard for all their lives. Now they believe anyway that they have to go get divorced so that the remaining spouse is not impoverished for the rest of their life, because they don't want to spend everything they've ever earned all their life to spend down their assets to the point that they can qualify for public assistance for the nursing home care. And that is something that I believe happens far more in this country than we know, because what elder couple is going to go around and tell their friends that they went and got divorced to save the money they worked so hard for all their lives? They're not going to tell you. But that happens over and over. I have seen it with my own eyeballs. So that is another tragedy that people should never have to get divorced because of our medical system. Yeah, that's something that people don't know about.
That stops under Medicare for All. Yeah. Exactly,
which I was really excited to read about. Somebody asked a question that we can't probably help you with, and that is, what did they say? Here it is. How are we going to get President Biden on board with single-payer health insurance? Okay, next question. No.
I have an idea.
Here's what I'll hear from you, Michael, and anybody else. My idea is this. I think that Joe Biden really wants to be president. I think that because he's run 4 times now, y'all. Okay? If he really wants to be president, and 70% of Americans want Medicare for all, I think we have a little leverage there. That's all I'm saying. Michael, what are you saying? What are you going to say?
I think it would be very easy. I think you actually said it best, but I think it'd be very easy for Vice President Biden to say, I support universal health care. And by the end of my term, we will guarantee health care for all Americans. I don't think he has to say the words Medicare for all. I think saying that is actually reflects his position. Then we can have a discussion over what we're talking about here, right? Kimberly and Amy and Kathy, is it coverage through private insurance or is it Medicare for all? That's a debate we can win. That's a debate we should have. And I think it's the real actual debate. And it is just what you all are saying. It's political will.
Yeah. I would like to say, too, never, ever underestimate the power that all of us have. All of us have the power to push our representatives and change the narrative. We've seen this across the country with many of us standing up, such as yourself, Kimberly, running for office, without going into politics thinking we want a political career. I know that wasn't the case for me. I'm sure it probably wasn't for you, Kimberly. But the power of all of us, think about that, everyone. They are not public celebrities. They are not these almighty and people. They are employed by all of us. Get active, get involved, raise your voice. You have a seat at the table. And all it takes is raising your voice and getting involved and supporting candidates like you, Kimberly, that are running on these issues. That sends the loudest, clearest message possible that now is the time. And we are not asking, we are demanding healthcare justice. We are demanding that everyone is covered. We're sick of seeing our neighbors, our children, our loved ones suffering, dying, trying to survive financially because we have a for-profit healthcare system. And that really is the most power that any of us have. And too often it's underutilized because most people don't realize they have that power, and you do. This is our government for the people, of the people.
Yep.
Sorry. That's like my.
No, that's good. I agree totally. And, you know, I don't, for those of you who, I think it's on Netflix. If you have Netflix, this is, first you're going to say, what is she talking about? But it's related. So there's a film called Crip Camp that is on Netflix. If any of you haven't seen it, go watch it. Like Crip Camp. And it's about this camp that existed, I think, in the late 60s or early 70s, sometime in the early 70s, where all these young people, I think they looked about all high school age, went to summer camp, and it was only for kids with disabilities. And it is a documentary, and it follows all of their lives through all of their lives. And the reason I'm mentioning it is because you're saying you don't realize how much power you have. A big part, not just a little part, a big part of the reason we have the Americans with Disabilities Act today, which fundamentally changed so many things for the lives of people with disabilities. We still have a lot of work to go, but it's way better than it used to be, is not because, although, you know, he was instrumental, not because just of Senator Tom Harkin, who pushed that boulder up the hill for a long time. We all love him, I love him. But because of the activists, because of those kids from the Crip Camp film and others that they took with them, who went and did a hunger strike and went to the Capitol and crawled up the Capitol steps and got out of their wheelchairs and went and protested and did all of this and occupied a building and like wouldn't refuse to leave, and all of that public pressure and all of the press from that. And it describes this all in the film, which is why I'm encouraging people to go watch it, because it's such a great film about activism and organizing and what you can get done with that. Ultimately, these senators and representatives were basically shamed into allowing the ADA and to voting for the ADA. Sure, Senator Harkin and others that were on his side were working from that end, but it was a lot of these activists who were publicly shaming these people who were against the ADA and telling their stories and, you know, explaining why we needed the ADA. And it's just, it's to your point, Amy, about we have to realize what our power is and what we are able to do. And we have to realize that we who have the time and money to do things like that have even a bigger responsibility, in my opinion, because there are people out there working 3 jobs with 3 kids, and they do not literally have the time to go protest in DC or do a sit-in or whatever. So those of us who do and can make the time, we better step it up because we need to be the ones that are being the accomplices and driving a lot of this change that's going to benefit the people that don't have the time or money or resources or connections or knowledge or whatever it is to be able to do it. Danielle made a comment. I'm a quadriplegic for the past 17 and a half years. She's 39 years old. She says, I'm stuck in a nursing home because I'm not sure what CDEC, or if that's a typo, or maybe that's a type of insurance, will only pay $600 to $900 a month for 24-hour care. But my insurance company pays $10,000 plus all of my Social Security to be in a nursing home. I've heard this story, Danielle. I'm sorry that that's your situation. I'm working hard to try to get to a place where I can have some say in changing that. I think what she's saying is what we were just talking about, Michael, that the emphasis is on getting her into a nursing home because then the insurance company is going to pay all this money versus it would cost so much less for her to be able to stay in her own home. But I'm guessing it's an MOC probably, if she's here in Iowa, is only going to pay $600 to $900 a month for 24-hour care in her home. And that's, of course, nobody's going to work for that. So
exactly.
Yeah. So Danielle, my understanding is that's exactly what Michael was talking about, that Medicare for All's emphasis is on what is more actually cost effective. But the good thing about that is that that's often the very exact same thing that's best, like keeping you in your home and providing care for you in your home. And just a PS point on that, in a pandemic where our nursing homes are getting all these infections of COVID-19 and people are losing their lives, it's far safer for you to be cared for in your own home than to be in some kind of a group care facility. Yep. Let's see. I already answered that one. Terry, if only we knew that answer. Terry asks, how can we get more voters to vote for candidates who pledge to not take money from corporate donors and billionaires? I guess tell your friends. I mean, seriously, Why do we all go to Amazon and read reviews before we buy something? Why? Why do we all go to Amazon? Why do all the websites have reviews? Why? Because we tend to believe what other people say. So if you're a person who believes that candidates who don't take corporate money should be elected, then tell all your friends, because we have literally figured out that if all our hardcore stated supporters told just 5 of their friends and got them to vote for me, we would win this primary in a landslide. That's how important it is that you tell your friends who you are supporting and why.
Right.
Yeah.
I also think, Kimberly, Medicare for All is a good marker because if you take corporate money, as we found in the presidential race, and as we see in these Senate primaries, you do not support Medicare for All. So it's a very good issue, and 70% of the people supported make it a voting issue. I'm going to only vote for candidates who support Medicare for All.
Right.
Yeah, and I've had a number of people say that to me, like, and that have been, pleasantly shocked that we have anyone running for U.S. Senate in Iowa who is for Medicare for All. So that's been good to provide people with a real choice. Yeah.
Well, and that goes across party lines. I think I saw a message in there. How do you go to people who are more conservative? And I can tell you, running in the district I ran, this was across party lines. When people are talking about healthcare, it's not Democrat versus Republican. Everyone is affected. And there are more Republicans that support Medicare for All than are against it. And the majority of Democrats are for Medicare for All. So when we talk about the majority of Americans are for Medicare for All. So this is a totally winnable policy, and it's because all of us are affected. No, there is, when you walk into an emergency room, it's not, well, if you're a Democrat, you go over here, and you're a Republican, you go over there. We're all faced with the same challenges. Mm-hmm. And this isn't about party. They want it to be about party, and they want to pivot us against each other on this issue, but this is not about party. They could care less about party. They care what is in your pocketbook. Yep. That is the delineating factor, right? That's the deciding factor. And so when we're talking about this is an issue that will resonate across party lines, across economic status. This is an issue that all of us are affected by. And if you think you're safe, you're not. Because again, we're only as safe as the most vulnerable. So it is a winning issue.
Yeah. And I've had people say to me, oh, how can you win the whole state of Iowa? You're so progressive. And first of all, I absolutely detest labels and buzzwords, and I've told my staff many times, do not ever use the word progressive when you're talking about me. And the reason I say that is because that label, people think they know what it means, and I don't think they do. And so I want to have a conversation with them about policy and values and goals. And do you really, Mr. Smith, want anyone dying from rationing their insulin in this country? And Mr. Smith will always say, of course not. And then we can start talking about how we get there instead of, well, you're a progressive, you're just socialist, I don't want to talk to you. That's not a good way to start a conversation. So if you know who you're talking to and they already agree with you, sure, call yourself a progressive. But if you are talking to people and trying to get them to hear you, the worst thing you can do, and this is the result of being a mediator for 17 years. I have mediated a lot of divorces. I know how to avoid labels and buzzwords and triggering words, and how to get people to start talking about what's important instead of attacking each other. As we say in mediation and in collaborative law, we attack the problem. We do not attack each other. We attack the problem. We do not attack each other. And that's just a good rule of thumb, applicable to almost anything, including politics. Why are we attacking each other? What's the problem? Let's attack the problem. And I agree with you. That has zero to do with party. But a lot of us are a little too, people are influenced by emotion. People vote with emotion. They vote with their gut and their heart. They do not vote with their head. If you think people vote with your head, then you need to think again. Sure, there might be a small percentage of people who are actually going to look at statistics and figures and say, oh yeah, this is a very rational decision. No. And that is why you have to marry statistics with stories that turn your gut and your heart. Because if you don't put those together, you will lose as somebody running for office. You have to understand human beings and how we work, me included, all of us, and then talk to people in a way that's not going to get them defensive off the bat, and that they can actually hear you. And that's different for different people. You have to know who you're talking to and try to elicit things that are common between you so that you can start to have some way of speaking with each other. Oh, yeah, Terry must have missed that. So Terry says, we already talked about this, but I'll just answer it super quickly. The insurance industry is a very large employer in some Midwestern cities like Omaha, and Des Moines. Is there a way to minimize impact to these employees under Medicare for All transformation? Terry, go back and watch because this is all going to be recorded. Go back and watch the earlier parts of this video, this forum, because Michael talks quite a bit about that there's actually a transition period, and I think it also involves paid training, retraining if people want to go into other industries, and just there's a very substantial part of a lengthy transition to people to other employment, or if they're very close to retirement, there's a provision for them to go ahead and retire and provides for pensions for them. So it's there's definitely a way to make sure that everybody who's currently employed in an industry who may no longer have that job because of Medicare for All, which is still going to need people to work in Medicare for All. So a lot of those people are just going to go work for the feds and hopefully make as much or more money with better benefits. That there's a way to address that in the bill. Tanya says it'd be great to add all the, I agree, Tanya. It'd be great to add all the Senate and House reps onto our insurance plans and then force the masses to take the healthcare seriously and get it right. If you force them to live with the insurance that we all live with. Yeah. Where would I start? Danielle, we're talking about a plan that we don't have yet. So Danielle said she didn't hear everything we said because she was getting cares done to her. We are talking about Medicare for All, which we don't have yet. So I'm running for office and working to get that to happen. So that's where we're talking about, or what we're talking about. Do we have what's happening in the chat? Anything else? Oh, thanks, Rebecca. Rebecca said that I have her vote. I think that's all that I see here, and we're almost at the end of our allotted. Yeah, wow, that's never happened. I've never finished a forum on time before in my life. Oh, yeah, thanks, Tim. So see, now we're going to go over by a couple minutes. So somebody says, well, this must be from Facebook. Oh, yeah, it's from a Facebook question. Will you explain to people why we should not settle for just having a Medicare option for people? Oh, why public? Yes, thank you for mentioning that. We should talk about that. We should definitely talk about that. Why is public option not okay? What are the actual downsides? Let's just say we had a cranking fabulous public option. It was great. What's wrong with that? I'll be devil's advocate. What's wrong with that? I'll be Pete Buttigieg. What's wrong with that? No.
Well, it doesn't solve the problem. The $450 billion savings that Medicare for All generates, the public option doesn't. The relieving of people from all the complexities of having to choose an insurance plan or having their boss choose an insurance plan, that still happens. The public option doesn't eliminate out-of-pocket expenses. When I said Medicare for All doesn't have copays or deductibles, public option, they're talking about it still would. The public option is a way to bail out the insurance industry because the public plan will, on the natural, attract people who really need health care because the benefits will be better, it will be a little less expensive, maybe the copays are lower. Well, the people who need care will flock into that plan. And you can talk to your folks in the insurance industry in Des Moines and Omaha, and they will tell you the insurance industry is very good at marketing plans to young and healthy people to make money. And so the private plans would exist in parallel to the public plans. Private plans do great, public plans overburdened. What happens? What's the scenario? The end game is, once again, public plan discredited because they can't sustain that. And the private plans say, see, we told you so. So the public option represents a false choice. It's marketed as, oh, it's the same as Medicare for All, just costs less. But that's not true. It's not comprehensive, doesn't have the same benefits, doesn't eliminate the copays, doesn't save money, and really doesn't guarantee healthcare for all.
Right. And that's what I've typically said to people as well. And I've also talked about the Affordable Care Act when that's been brought up. And I've said, look, we've already played with the idea of these like public exchanges. And where we've had that, they've left. it's not profitable enough for them. I mean, we've got down at one point to like one maybe provider for a little while in Iowa, literally one. Everyone else had left the exchanges because it was mostly, sort of the people that were that didn't have health insurance through their job, that made a little too much money to be on Medicaid, but not enough money to pay these ridiculous prices. In fact, our campaign manager, I don't know if Jody's around on this call or on this Zoom, but she's looking into health insurance plans right now because in a few more months, she's not going to have health insurance. And I can't remember the exact number, but I think $2,000 a month ballpark. She looked for a plan for her family on the exchange, and it was going to be around $2,000 a month. And just P.S., I know Jody wouldn't mind me saying this, she's not wealthy. Like her family income is not like $200,000 a year, not even 100. So it's like, I'm guessing that's way over, probably in the ballpark of at least half their income, if not more, in a month, just for the premiums. And then it had like a $5,000 or $10,000 deductible on top of that.
Right.
And
let's
that
talk about, it leaves gaps in the system too, right? We're talking about Jody possibly not having insurance. When there's cracks in the system, inevitably that will lead in healthcare to death. We're not talking about a commodity. We're not talking about a cell phone or a good or we're talking about people's lives. So when we talk about a gap in the system, when we're doing a public option, inevitably someone will fall through the cracks. And as long as you're okay with that, possibly could be your 27-year-old child or your best friend or your neighbor or your coworker. I mean, this is what we're talking about. The repercussions are real. And I know for a lot of people, it's just a number. But it's not if it's somebody that you care for, someone that you love, someone that means the world to you. It's more than a number. And again, it goes back to community, as Michael was talking about, and you as well, that, we are a community. And what affects our brother and sister, our neighbor, our loved ones, it affects all of us, and all of us are vulnerable. So again, as long as there's a crack, as long as there's a someone being left out, disproportionately it will be poor people, and disproportionately it will be people of color. And that's what we're talking about. And we have to be okay with that, to say that we're just fine with a public system. Yep.
Speaking of people you love, today we released a video that's on our campaign Facebook page and on our Twitter and everywhere for those of you, anybody who's watching this, or any of you panelists who haven't seen it and want to go take a look. Last summer in May or June, I was really lucky to meet somebody named Robin Stone, who was the Delaware County Democratic Party chair. And she invited me to come speak, and she heard that I was running for U.S. Senate on Medicare for All was one of my platforms. And Robin was a longtime healthcare activist and believer in Medicare for All. And I was so lucky to meet her. And I've told her daughter this. She has an adult daughter that I'm in touch with still, that I feel really ripped off because that I didn't get to know Robin longer. Robin was diagnosed with a rare aggressive form of thyroid cancer last summer, and by early November, she had passed away. And she wanted to go to the Mayo Clinic. This is all in the video, but she wanted to go to the Mayo Clinic and she had insurance, but Mayo Clinic was out of network, and they wanted $16,000 to let her in the door. And I remember her posting about this on Facebook, saying, hey, I really want to go to Mayo. That's where these people that really know my particular type of aggressive thyroid cancer, that's where the experts are. She couldn't go. She didn't go. And would she have lived longer? Would her remaining days have been even better quality if she'd been able to go to Mayo? We'll never know because she didn't have that choice. She couldn't do it. She couldn't afford to do it. And so that's why, she texted me about a week before she died and said, I want to endorse you. And she knew she was dying. And she said, I want to endorse you. And don't you ever stop fighting for universal single payer healthcare. And I said, okay, I won't. And I won't. And, her story is just one of hundreds of thousands, if not millions in this country of people that might still be here if we had a universal single payer healthcare system. It's easy to get all eye rolly and think that's hyperbole, if that has never happened to you or touched you or someone you love. But I'm here to tell you it's not. It's the truth. And so we all need to wake up to that. And if anything good can come of this horrific pandemic, I hope it is that we start realizing your insurance should never be tied to your job, with millions of people now losing their jobs. And that this should be a fundamental human right. As Tim's just posted, GoFundMe is not a healthcare plan. And as Samantha, one of our staffers, just wrote, the only way she's been able to be in self-employed and work in entrepreneurial roles, work in campaigns, is because she's still under 26 for another year. And she's been able to be on her parents' health insurance. Otherwise, she wouldn't be able to. And yeah, I mean, hopefully she can go out and get a really high-paying job that has really good health insurance, because otherwise she's sunk like so many. I mean, my son is 20. In 6 years, he won't be able to be on his dad's IBEW plan. Diabetes runs in my son's dad's family, not in mine, thank goodness, but in the other side of the family. What if my son ends up, diabetic and can't afford his insulin? I don't want him to join the ranks of 26-year-olds dying from rationing insulin in this country. So with that, I just want to thank you all so much for being here and for all the work you're doing and will be doing and have done to work for a universal single-payer Medicare for all system. Hopefully, in a few years, we can all get together and be flabbergasted that we ever didn't have a universal single-payer healthcare.
I'm down for that party.
Yeah.
I hope someday, just like we can never believe there was a day we didn't have curb cutouts so that people in wheelchairs could get up a curb, we'll look back and go, wow, how did we ever not have a universal single-payer healthcare system? So thank you so much for everyone, for all your questions, for being here. If you live in Iowa and you are a registered voter, you should have already received your absentee ballot request form. Bear with me, this is a little complicated. Didn't have to be this complicated, but it is. You should have already received your absentee ballot request form in the mail. You have to fill that out. It already has a stamp on it. Fill it out, send it in. Then they will send you an absentee ballot. You have to fill that out and send that in, and then you will have voted. If for whatever reason you have moved or you didn't get an absentee ballot request form in the mail, you can either call your auditor's office in your county, just Google it, call your auditor's office and say, I want an absentee ballot request form, and they will send you one. Send that back in, and then the same thing, you'll get your ballot. Or you can print, if you have a printer at home, you can go to the Secretary of State website, the Iowa Secretary of State website, and print an absentee ballot request form and mail that in. So those are the ways. But vote, and vote early. And please do not go to the polls. There will be some open, but not very many on June 2nd. Please don't go there. Please vote by mail early. We do not need to endanger anyone by going to vote in person when we can vote by mail this year. And Iowa's COVID-19 cases are getting more and they're going up every single day. We are not on any kind of downward trajectory in Iowa. So please do not go to the polls to vote. You can also go to kimberlyforiowa.com/vote, and that will walk you through everything I just said as well. So thanks so much, everybody. I hope to see you again on the other side of all this. Thank you for all your work. It was so nice to meet all of you. Well, I already knew you, Amy, but nice to see you. And nice to see you again, Kathy. So nice to meet you, Michael. And we will see everybody later. Good night. Thank you so much.
All right.
Bye-bye. Stay safe.
Good night.